Okay, well, thank you all for being here. I'd like to thank Dr. Bal, Dr. Das, Dr. Sheth, the organizing committee for this excellent meeting and for inviting me to be here with you. It's been really thrilling. So I'm going to talk about risk, adaptation, and resilience, and hopefully you can hear me okay, and how we think about these concepts, especially when we're trying to study the health impacts of climate change, mostly in epidemiology, but this applies, to all the work that you guys do. So I'm going to, in 30 minutes, try to touch on some important concepts about vulnerability and adaptation and how we think about these. Try to give you some examples of work we're doing in this new Climate and Health Center that we just launched at USC. Give you some examples of how we measure some of these things, and then hopefully connect to some emerging fields and opportunities and efforts that we have going on now that I hope will kind of provide a bridge for future collaboration and opportunities to connect more in this space. So I think yesterday we saw a similar slide, but it's no surprise to any one of you that we're seeing increasingly massive impacts of climate change, disasters or events. This map shows you just in 2024 the different types of weather and climate disasters the US experienced. There were 27 different events that cost over $182 billion, and this does not include the January 2015 wildfire events. And you see some of these are unique types of events, and others are these combinations of events. And I'm saying this because the concept of compound climate events is becoming more and more important for us to think about. So I would say that's another key word for us today. Most of you are very aware of what happened in Los Angeles in January, just last month, right? And this has been, keeping us very busy in terms of responding from a public health perspective and launching research studies. Most of you think of these as the fires, the wildfires that happened, when in reality, what happened was we started out with massive Santa Ana winds, which are very, very strong winds that caused a lot of damage, broken structures, fallen power lines. That ignited one massive fire, followed by 8 other massive fires that were so difficult to contain because the wind was so strong that the firefighters could not respond. Planes couldn't fly to try to turn these fires out. And so this chain of events, or this series of events, is what we call compound climate events, meaning the drivers and the processes leading to these things happening back to back are very correlated, and they're not independent events. And as soon as the fires were a little bit under control, we got some rain, which then caused fears and concerns of landslides. And actually, even up to now, last week, more rain is bringing massive landslides. So you see this whole series of events is actually a climate change compound event, and when we think of them as one thing at a time or independent events, we really risk underestimating their impact and under-preparing for how to deal or manage them, their effects. So I feel like I don't need to tell this audience, but there are many different climate change-related health outcomes that we worry about, and the way climate hazards impact our health sort of through 2 pathways that are really important, either through exposures that we might experience, like wildfire smoke, heat stress, different types of infections. But also you see here on the left, vulnerability factors are very, very important for us to try to understand these health impacts. So what does that mean? And I like to draw sort of parallels between fields because I think we all think about problems in our own way, but really it's all very connected. So I do a lot of work in the environmental health disparities or inequities space. Traditionally, when we think about what is driving environmental health inequities, we think of this double jeopardy, meaning some groups are very highly exposed, perhaps disproportionately than others, to many environmental pollutants and contaminants. But it's not just exposure, it's also vulnerability that is driving these health disparities. It means even if they got the same exact exposure as everyone else, they are at much higher risk of developing an adverse health outcome because they are more vulnerable. So it's the interaction of these two things together that is driving the health impacts and especially inequities in the health burden. Now, when we think of climate change, we're really very quickly realizing that we can adapt the same framework but expand vulnerability to also think of adaptation, our ability to adjust or adapt to these hazards, and resilience, the ability to recover, hopefully quickly, from any damage or impact of these hazards as well. So in the kind of more traditional environmental health disparities world, the way we define vulnerability is either, again, because of sort of disproportionate exposures, but we break down the concept of vulnerability into what we call extrinsic factors and intrinsic factors. So extrinsic factors are things like social vulnerability, factors related to socioeconomic status or living in poverty, not having access to healthcare, experiencing chronically over time repeated stressors in your day-to-day life, like experiencing discrimination, not having power over your own health and well-being at work, labor rights. Your occupation sometimes could put you in a disadvantaged position, right? But we also think about biological susceptibility or internal, intrinsic factors that make us more vulnerable. And so these could be life stage. We talked about pregnant women a lot, infants, babies, elderly. Could be sex in some cases, could be underlying health conditions or malnutrition. So when we're trying to assess vulnerability, we're trying to kind of capture all of these different things. When you look at frameworks for climate change vulnerability, we use different words, but really they're exactly the same concepts. So you've seen examples of this yesterday, but basically, again, we're thinking who is most exposed, who is most sensitive, and what is the ability to adapt or adjust to these things. Together, these are driving vulnerability to the health effects of climate change. Of course, resilience is an important piece of this. It could be that you're resilient before you experience the health outcome or afterwards, but all of this is contributing to health outcomes of climate change. So I'm excited to share that this has really driven sort of our thinking in how we want to launch studies around understanding climate impacts. And we just got a center launched in September from the NIH Climate Change and Health Initiative, actually, called CLIMA, or the Climate-Related Exposures, Adaptation, and Health Equity Center that I direct at USC. And the beautiful thing about this center, and I was just talking to trainees earlier, is that it's really a very transdisciplinary team and methods that we're bringing in to understand climate change impacts, and especially sort of use data to look at what would work for solutions to increase adaptation and resilience. And so I won't go through every name, but I'm the director of the center. Rob McConnell is the deputy director. And this fantastic team of investigators actually consists of epidemiologists, biostatisticians, engineers, atmospheric scientists, spatial scientists, communications experts, community engagement experts. So that just tells you, really, we need an all-hands-on-deck type of approach, and we cannot keep working in our own silos to try to address climate change or really anything in environmental health, I think. Very briefly, what we're hoping to do in the center, and again, we just started in September, so I wish I could show you results, but we're not there yet. But we are building high spatiotemporal resolution models of exposures that we care about in California. Doesn't mean these are the only ones that matter, of course, but for us, this is a priority. So urban heat islands, wildfire smoke, and the chemistry of that smoke, which is very complicated, air quality, but also things that we think of as system-wide adaptation capacity, or things that could be at risk of adaptation, kind of poor adaptation, like the power grid system and power outages, and also more natural types of ways that we could adapt. So building three-dimensional models of urban vegetations and trees to try to understand if they impact cooling and shade and how much do they do that. We are relating all these exposures and adaptation factors to cardiovascular health outcomes in 2 different projects. The first one is led by Erica Garcia and Sandy Eckel, and there we are leveraging electronic medical records to look at heart failure, hospitalization risk, and rehospitalization in older adults. So, when you look at medical records, this gives you a very nice kind of population level approach, but it's not very, let's say, individualized assessments because you're working with administrative data. But on the other hand, in a second project, we are looking in a longitudinal cohort study that is led by Dr. Shoureh Farzan and myself at young adults who we followed up over time. And we are looking at the association of wildfire smoke and heat stress with their cardiovascular risk progression earlier in life, and with this measure called allostatic loads that we think could be a real good marker of biological resilience to some of these impacts. And I'll explain what that means in a little bit. And of course, we have the amazing Jill Johnston and Robin Stevens leading community engagement, which is, of course, very, very important. So, the next chapter, I want to give you very briefly some examples of how we measure some of these climate-related exposures and vulnerability factors. And by measure, I mean, sometimes actually measure, sometimes estimate or model. And some of these approaches are what I call population level, these kind of macro level ways to estimate things, versus more individual level tools that we have that I'll get to next. So in my work, and you saw examples of this a little bit yesterday, we build air pollution models that use deep learning and machine learning and integrate very kind of diverse sources of data and information to predict air pollution. We've done a lot of work around PM 2.5 and especially around being able to predict wildfire impacts on PM 2.5 concentrations. So for example, the model on the left is an hourly model for Los Angeles. The one on the right uses satellite data and chemical transport models and sort of more advanced dispersion models of wildfire smoke to, again, predict these things. And we don't have time for the details, but if you're interested, please look at those papers. But a few key points I want to make is, first of all, with these methods, we can we have a lot of great ability now to predict or reproduce concentrations of air pollution, either in sort of typical days in Los Angeles, like you see here on the left, so these are different hours of the day, or during wildfire events. So you see here, this was actually 2018, a very major wildfire called the Woolsey wildfire in Malibu, close to where the Pacific Palisades now happened. And we were able to basically reproduce the very high concentrations of PM 2.5 due to that wildfire using these kinds of models. Now, I don't know if any of you have been in the US on the 4th of July, which is Independence Day, where there's so many fireworks. And if you have, you would know that by the end of the day, at night, you really can't see anything anymore because of the fireworks. So again, it was like a good kind of validation of our model that we were able to see that impact. But another key point is, these are all very pretty pictures, right? But it's actually very difficult to be able to predict wildfire smoke impacts on ground level air quality. Because wildfire smoke is so dynamic, it behaves let's say, unpredictably. Plumes can rise very, very quickly. So this is, again, the Woolsey fire, where ground level air quality can be great, actually, but the smoke is going up. And then it travels depending on the weather and so on. So, this was not an easy task. And just because of the, again, very recent example, I thought I'll show you these screenshots of the fire.airnow.gov website on January 10th when we had, the Palisades and the Eaton fires burning. And these are what we call NOAA smoke plumes from the hazard mapping system. The only point I want to make here is that wildfire smoke does not behave very nicely, right? It doesn't go in like one uniform direction. Just look at all the swirling happening, which makes our job very difficult when we're trying to predict it, right, for health studies. Anyway, another key resource that I want to share, since we're talking about remote sensing data and these kind of massive data sets, is the NASA Maya mission. So I'm a science advisor for this mission, and it's called the Multi-Angle Imager for Aerosols. So if you are doing any kinds of health studies here in India, or planning to, this is a great resource for you to learn more about, and you can go on their website, be an early adopter, sign up for their trainings. Basically, in around 2027, you're going to start getting very highly resolved daily speciated PM2.5 data for at least Delhi, which is a primary target area you see there, and then for some secondary target areas in India. So this is, in our world, considered very advanced sort of measurement and monitoring data that will soon be available for health studies. So highly encourage you to check it out, and you can look at that website to see exactly where those target areas of coverage are. Okay, moving on to vulnerability. So we talked about exposure. We have multiple different ways of assessing climate vulnerability at the community level, and this is one great example from the US of work done by EDF and Texas A&M, where they really kind of compiled data across the US on baseline vulnerabilities, things that impact communities' resilience, and on direct and indirect climate risks, so hazards, damage now and predicted in the future. And so they compile all this information together, and they provide you a score that we can then take and put on a map and overlay it with where our participants are in our different studies. And so you see here, this is Los Angeles, and the more yellow kind of census tracts or neighborhoods are where the highest climate vulnerability exists. This is the total score, and obviously we can't get into the details because it's hard to see, but I just want to make a point that when you put everything together, this is what the vulnerability map looks like, but when you break it down into the different components, the spatial patterns of these things could be very different. So it really matters if you're trying to kind of look at something you can intervene upon, like infrastructure. You want to focus on one of these maps versus the total vulnerability. It's important to understand these determinants, right? I was also very curious to see if India had something similar, and I don't know if this is the sort of most comprehensive one, but this looked pretty interesting, and I thought you guys would like to see this index developed by the Council on Energy, Environment, and Water. It looks like they've grouped vulnerability to different climate events. It sounds familiar. And I was really curious to see what Ahmedabad and Gujarat score is. And so there's high vulnerability to flood and drought here, which I'm sure is not news to you, but was very interesting for me to learn. Okay, let's move to more individual level types of assessments of how we can look at exposures and vulnerability factors. And again, I'm sorry we don't have too much time for details, but I'm hoping this is a good overview. So in my work, we do a lot of personal monitoring with pregnant women, with children who have asthma. Now we have the tools, the sensors, the wearables, the GPS trackers, to really deploy sensors on people and measure exactly what they're exposed to. So that could be air pollution, it could be heat stress, it could be anything you're interested in. And we've done a lot of these studies where we pair the measurements with GPS at a very high resolution, and that allows us to basically understand where and when the participants are experiencing these exposures, if we want to, again, try to intervene on them. And one very quick example, without getting into the weeds, but one thing we've learned by doing these personal monitoring studies during wildfires is that the sort of agreement between what we're breathing in our personal zone versus what is happening outside suddenly becomes very poor when wildfires are going on. And that's because people can perceive wildfire smoke, and they start to change their behaviors and protect themselves by staying indoors, running air conditioning, etc. And that's not typical for all air pollution. People can't always realize that there's high air pollution outside, but that's a special case that we see in wildfire smoke. So that's just one thing we learn. More on the vulnerability side, again, sort of looking at a very personal level, based on several different biomarker measurements and anthropometrics, we're looking at this multi-systemic index called allostatic load that we think could really explain sort of resilience or the ability to withstand impacts of environmental exposures and climate-related hazards. So if you are someone, let's say if you look at the light blue zone, who experiences a stressor, generally you respond to that stress and then you go back to normal levels. But for individuals who are chronically experiencing a lot of stress from, again, all those vulnerability factors we talked about, what happens with allostatic load is that over time, your kind of organ systems, your physiology cannot adapt anymore. So it becomes dysregulated and your stress response sort of never goes back to normal. So we're looking at allostatic load as one way to be able to better understand this resilience, basically. There is no one way that everyone agrees upon for measuring allostatic load, but we're doing it with 15 different markers of immune, neuroendocrine, cardiovascular, metabolic health, etc. And we're just starting to look at this in a pregnancy cohort that we have in Los Angeles. So this is downtown Los Angeles, and we're recruiting women from very environmentally burdened neighborhoods without, again, spending too much time. But what we do is we figure out exactly where the woman and the baby lived at every day during the pregnancy, which is in red here, before the pregnancy and after the pregnancy. And we overlay that information with wildfire information. So where is the fire happening? Was there an active wildfire at the time? How big was the fire? What were the smoke levels, etc.? And right away you see, this is at least 5 years ago now, but there's quite a bit of overlap with days of wildfire in Southern California with these pregnancy periods. In the old days, we used to think this is like a rare event. You get a wildfire once and then you forget about it. But the reality is we're seeing on average these women experience 130 days of active wildfires during their pregnancy and up to almost 7 months out of the 9 months in terms of the maximum. So we take all this information, we relate it, of course, with the health outcomes that we're gathering. And so this is work by Roxana, my postdoc, that is about to get published, actually. It's under review. And we're starting to see that there are significant effects of heat stress that we modeled with wet bulb globe temperature, exposure to wildfire days during the preconception period, and the risk of the baby being born small for gestational age. And actually, we see that if the woman lives in a climate-vulnerable neighborhood, in the top 75th percentile, that risk almost doubles. So there's a very strong effect modification based on living in a climate-vulnerable neighborhood. So again, this is sort of demonstrating the concepts that we've been talking about. We're just starting to do this also, but looking at how allostatic load sort of associates with the climate vulnerability index itself. And it looks like some of the kind of domains within vulnerability, especially around infrastructure, are associated with higher odds of being in the very high category of allostatic load. Now, this is all very preliminary, but just to give you a sense of where we're going with this. Okay, and I think, yes, I have a few more minutes, so I just want to wrap up by kind of connecting the dots a little bit on some emerging fields that I'm seeing in my work, either have been around for a while or we're kind of circling back to in how we think about climate and health and really all things environmental health. And I'm hoping these would be interesting for you. So the EPA actually very recently changed its research framework to cumulative impacts research. And it's this idea that came out of, again, the environmental justice world, that our health is not just influenced by chemical stressors. It's chemicals, non-chemical stressors, lifestyle, behaviors, social factors, all together influencing our health and well-being. I think I have 5 more minutes, no? My timer says 5. Okay, I'll wrap up, no worries. There's also planetary health that you heard a little bit about yesterday. There's exposomics, which is this new field, again, that is saying that it's the totality of all these exposures that we experience that are directly influencing our health and well-being. So not just what we experience in the external environment, but also in the internal environment. And nowadays we can measure these things. So I'm saying this because we just launched a research coordination center in the US called Nexus. We were funded by several different NIH agencies. This is a really exciting time because Gary Miller, you see here, is our fearless leader, and I get to co-direct the center with him and with Chirag Patel. We are basically charged with developing the frameworks and coordinating at a global level exposomics research for precision environmental health. I won't get into the details for the sake of time, but I'm also co-leading the Geospatial Sciences Hub within Nexus with Dr. Arkot Rajasakar, who's amazing. And we're doing exactly what I've been talking about. We're trying to sort of advance methods for how to do all things geospatial for assessing environment, but also personal monitoring and wearables and so on. If you do any kind of work measuring metabolites, metabolomics, adducts, anything really in biospecimens, on behalf of my colleague, Dr. Crystal Pullett, we would love it if you would fill out the survey and be more involved in efforts around harmonizing, GCMS and multi-omic types of measurements, and I'm happy to share this later. I promise I'm wrapping up. But also, I want to show you this map of our leadership, our collaborators, our partners across the globe, and you'll notice we are missing representation from India, and we'd love for the leadership here, anyone interested really, to just go to our website, learn how to be more involved, but especially for this big Moonshot event that we have coming up in May, we're trying to bring together stakeholders to draw the roadmap for exposomics going forward. And I think my last slide is, again, sort of from my experience and kind of vision to the future, especially for trainees in the room. I really firmly believe that we need more transdisciplinary science education and research opportunities. I work very closely with our Population Health and Place PhD program in our Spatial Sciences Institute, which is really public health combined with GIS and sociology and demography. Check out this information session, YouTube, if you're interested. Mr. Shishir will be here tomorrow if you're also interested in talking with him about our programs. He unfortunately couldn't be here today, but you can also go to our USC India office webpage and follow the newsletter and the LinkedIn page and all that and learn more. Okay, so I think I actually made it. Thank you all so much, just acknowledging my funding sources, and please follow us on all these channels. Thanks for having me.
Thank you. It's very important to understand the vulnerability paradigm in terms of exposure, sensitivity, and ability to adapt. So putting those together is very relevant. And you gave examples of wildfire. In India, in the winter months particularly, we have man-made fire, that is the farm fire that happens in northern India when the crop residue are burned. And that happens to be a very significant moving factor for air pollution in the northern plains of the country. So it's very relevant to that. And as a public health person, I'm sure all of us sitting here will appreciate the need to take epidemiological perspectives from two angles, the population and the individual. Yeah. And making that difference of having climate vulnerability posed to the population as a group and the individual susceptibility, because the adaptation resilience and will come from individual susceptibility, not the generic level. So thank you for bringing that to the fore, and I am sure it will inspire many of us sitting here to take up work and join hands with the group. And also the final word in that sense, that it's always a collective work of doctors, public health persons, epidemiologists, engineers, environmental scientists, and whoever you have is mandatory to work together, as your last slide showed, the kind of people who have joined hands. We look forward to joining hands with you in that. Now I open it for questions to Dr. Rima. Yes, sir.
Right here.
Can you give a mic to him?
Yeah.
Dr. Arun?
Thank you.
I'm sorry. I saw that hand first. I'll come back to you. Sorry, ma'am. Yeah.
Thank you. I highly appreciate and love the discussion which went here. But simultaneously, research and development, R&D is also going on latest to our technologies. R&D also going for animal farming, which is also one of the major cause for greenhouse gases. And we also know the climate change for AI. So there are also many examples of R&D which are detrimental for climate. They get more fund. They also have more administrative power. So do you think we will be able to do enough for mitigating and managing climate change? Thank you.
Yeah, thank you for that. And I apologize because I don't fully understand the question, but I think you're saying that there are many factors in the environment, right, with animals and farming and.
R&D going for both sides. Both are getting funds. Also, we environmental scientists, and also those which are those things, technologies and research, which are detrimental to climate change. And they have more power. They have more funds, as we are seeing in current US government policy also.
Yeah. So I think this is a very tough question, right? I think in all things in life, right? Technological advancement, kind of newer technologies, countries that have more money, people that have more money, sometimes drive things forward in good ways and sometimes in bad ways, right? But I think, the beauty of the times we live in is that really information is everywhere. The challenge is filtering through that information and knowing who to listen to and who to learn from. Right? But I think all of you guys can do such impactful work here. Another point I wanted to make, if you don't mind, not directly your question, but related to the comments you're making, is local context and culture matter a lot in all this work that we do, right? Probably very few things of what I presented that we do in LA actually matter more on the ground here. And you guys know this, right? You're the local experts. I'm from Lebanon originally, and I know very much that the problems we face there are different in terms of, what they are and how to deal with them and what's culturally appropriate and the context around them. But fundamentally, the tools and the methods and the research and the science that you can do, this is common across the globe in terms of your training for how you can tackle these things. So I agree with you that, there's all sorts of ways and you can do it all, but you also have to work within the power that you have locally because nobody understands it better than you.
Thank you so much.
Yeah,
Sure.
that's very meaningful in the sense that when we talk about these kind of climate adversities, the response of the community is very much embedded in the cultural systems. And people respond differently and they have their own resilient systems which have been there prior to the scientific advancement. And making use of that, adapting that to the modern requirement and combining with the technology, we will be in a better position to handle the situation. Sorry, ma'am, please go ahead with your question. Yeah.
Very quickly, just. It is on, yeah. Yeah, all right. It's on, yeah? Yeah. Well, thank you, Rima. That was a fantastic tour de force of all that we need to be thinking about. You'll be happy to know that Dr. Prabhakaran gave a very nice, elegant example of an exposomic approach for ambient air pollution that he's developing. And then, this afternoon I'll get a chance to talk about the rural side of things in terms of, a completely different exposure context. Could you kindly comment on how you see the exposomic outputs, or for that matter, not even the exposomics, but all these other longitudinal surveillance outputs for exposures and outcomes linked to climate feed into what might become climate and health observatories In Europe, they have seem to have really, harnessed the data, but not quite in such an integrated way. Observatories are really important, but they can't really collect all these pieces of data and sort of synthesize them. But I think they need that. Without these, integrated outputs from the exposomics approaches going into observatories, it might be really difficult for administrators to sort of make use of all this information.
Yeah, 100%. And thank you so much for saying that, because you brought up a very important point that I probably glossed over very quickly. One of the biggest challenges we're trying to tackle in Nexus, really, and we just started in September, but the first thing we did is we had a meeting with European partners to really think about how to connect all our research infrastructure to start to really be global and how we're all connected and how we're doing things. Because you're right, in Europe they have this massive sort of investment and ability, these harmonized, beautiful cohorts that, across the entire European Union. We have many amazing cohorts in the US even that are not at all harmonized, that are so hard to bring together. And exactly the example from yesterday, I was thinking with all this kind of rich exposomic approach, all the biospecimen data, it would be so amazing to basically connect again to the network. And that's why we'd love for you and all these experts here to help engage with us to really make this global. I think, again, the methods and the tools could be very universal, right? And we need to harmonize and standardize methods. But again, there's no sort of connecting it to the real world, except in a very local, I think, informed way, because, everybody knows their context the best and how to serve it for policy. Yeah, thank you for that.
Well, the chairs always have this tough task of balancing